but it's just precaution. That's the word I'm looking for, a precaution. 21 days is a small price to pay, okay, to make sure that your nation is safe. USA, okay? We have to think of our nation. One nation under God. We got to think of our neighbors. And lastly, after 21 days, this is from the Center for Disease Control right here. After 21 days, if an exposed person does not develop symptoms, they will not become sick with Ebola. 21 days is the perfect amount to keep them quarantined and away from people because you are ensuring that everyone else in the United States is safe. Thank you.
America.
Okay. Good point, good point. So, gonna make America safe. But here's the question. The people who we talked about that were quarantined in Connecticut, their family is allowed to come back and forth and bring them food. So obviously, it's not that big of a deal. They're not catching it from their family members. So why, when you get off a plane, should you be quarantined? It doesn't make any sense. And then what it comes down to do is basic human rights. Like, we're not animals. What are we being quarantined for? When someone comes to class and they have the flu and they're coughing and sneezing and touching everything, we're not saying, oh, you're sick, let's quarantine you. We don't do that when they're normally sick and you could actually catch it from a cough or a sneeze. Whereas this is through like bodily fluids and needles, like, and they talk about the needles, like doctors aren't reusing needles. Like, a doctor's not gonna stick somebody who has Ebola with the needle, and then turn around and be like, oh, you look healthy, I'm gonna stick you too. It doesn't work like that. You know, more or less, we're afraid of a word. There's only 4 confirmed cases in the United States. There's only 1 death. Like, it's not as big here as it is in other places because we're better able to control it. But controlling it doesn't necessarily mean quarantining people. Especially if you're not, like, you can't infect somebody until you have a fever. So why not let the people make their own decision and actually, okay, I got the fever, you know, I know where I came from. Why not go to the doctor myself? Why does it have to be something that's forced upon us because we have to think about our neighbors?
Good show.
All right, you're going into your conclusion now.
So in conclusion, quarantine is not worth the cost because it's really lacking knowledge and it deprives the individual of the freedom. So basically what they mean by that is they can't just put everyone into quarantine because that would be like a high cost for the economy and for the hospitals. The swine flu is like an example because how when it first came out, it kind of terrified everyone and it was all around the media. Everyone was scared for their life, that their life would be in danger. So that's a good example. I don't agree how quarantine takes away constitutional rights. No, I agree how quarantine takes away the constitutional rights of the people because once, if they all came from Africa, they're all like suspicious of the disease, so they don't want to take no.
Are you going to keep looking at the floor, or are you going to make some eye contact with your audience?
They don't want to take no risk of endangering the economy with people.
Everybody. Make eye contact with everybody. Yes, because it's time.
Okay.
Third speech.
Okay, so I don't agree how the quarantine people who actually do the 21 days of the speech. Quarantine people that actually do the 21 days in the hospital, they turn out to be negative, so it's a waste of time for the people in the hospital. And I'm gonna get to my video about how one of the opinions of the nurse who had to be forced to do the quarantine.
constitutionally just. And so I am not going to sit around and be bullied by politicians and forced to stay in my home when I am not a risk to the American public. We know that if I developed symptoms, I would isolate in my house. I would call the health department and I would arrange to be safely transferred and tested in a facility that was prepared to safely do those things for me.
This all started when you got to New Jersey, though, Casey. And let me just go back and put this into context. When you arrived at Liberty or Newark Liberty International Airport and told people you had just been in Sierra Leone and you'd been treating Ebola patients, and they used that thermal scanner on your forehead after a few hours and it registered you at 101. You have to remember that just a couple of days earlier, Dr. Craig Spencer returned from Guinea where he was treating Ebola patients. He moved freely about the New York area. Then he developed symptoms and was diagnosed with Ebola. Do you understand what that did to the psyche of public officials in what is a metropolis of 9 million people?
Of course, I do understand that it has created a lot of fear, but we still have to make policies based on evidence. And, you know, the issue at Newark Airport is sort of a different issue. I saw complete disorganization. I saw no leadership. And if you're going to put a policy like that in place that, you know, impedes on my civil rights, then you need to have the administrative details worked out before you start detaining me in an airport for no reason.
I'm going to ask Norm this question in a second. Are you prepared to take legal action, not only?
So that was Nurse Maine, how she was giving her thoughts, how she got held down in the airport, that they told her that you might be suspicious of the disease. So she had to be held at the hospital for 21 days, and she didn't like how, even though she said no, they still told her, oh, you have no choice, we're going to put you in. Thank you.
Okay.
Yeah, that was a good point. I think I do not side with that lady's point of view. I think that she's completely irresponsible for making such a big deal about it and wanting to not be quarantined for the 21 days. You know, it puts a lot of other people at risk if you know, if we kind of go that way with, you know, not quarantine. But the 21-day quarantine, it's not just a number they pick, 21. It's actually the incubation period of the Ebola virus. Incubation period being the interval of time from infection to when symptoms would occur. So pretty much they're figuring 22 days, you're fine. But 21 days, we're going to hold you. Okay. Now, it's really easy to transfer. I mean, that's a good reason we need to impose this quarantine on people who are showing symptoms. The survival is really low. As I stated before, the death rate is now, they're figuring, WHO is figuring it's at 70%. I mean, the quarantine should happen. You know, United States, this is our homeland. Let's keep it safe. Let's enact some measures and have some sort of guidelines. You know, what if something occurs like this in the future, and that maybe not Ebola, but you know, we gotta have some sort of not curriculum, but like guideline, like I said, to fight against a pandemic like this. Like, if we don't have measures like this, like you could take the bubonic plague, for example, that wiped out 30 to 60% of Europe's population way back in the 1300s. You know, it killed 75 to 200 million people because they didn't know what to do with it. You know, they had no policies in place to fight against the spread of it. So it just completely wiped out, almost completely wiped out Eastern Europe, or Western Europe.
Nick, get rid of your gum.
Alright. Well, that was my closing argument. Thank you, Erin. Yeah. Done.
Alright, just to pick up, like, to touch on a couple more things you said. The clip shown, too, the nurse stated how if she had these symptoms, she would have reported herself. That's completely different from, like, what a normal person would have done, too, because she is a health official, and she knows, like, what to look for, what she should be expecting, stuff like that. Where if it had just been a normal person, they would just think they had the flu or something, not take it as serious. You know, just politics is the one person. And our opposition touched on how we don't have as many cases in the U.S. because we have better control, which is exactly why we need to keep the present day quarantine 21-day policy like in order, because obviously we're doing a good job. Like, it might be, like, they might, like, have shown it as looking a little, like, over the top, a little unnecessary, but obviously it's getting the job done. Like, we've only had 4 cases. And, you can't put a price on people's lives.
Cannot.
Is that the last of your conclusion, or are you gonna go into your conclusion?
I think that was it.
I think that was the last of it.
The verdict. Boom. Boom. Boom.
All right, give your classmates a hand.